And he may be on his summer vacation, but he's carving out a little time for us this morning. Joining us live this morning is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Appreciate you joining us this morning, Dr. Bogoch. Hope you're enjoying your time away. But let's start here. I remember I was in grade 6 when HIV/AIDS really hit. And so this is incredible to think that there's incredible news out of the International AIDS Society Conference now on HIV science. Some of the successes in this antiretroviral therapy is really remarkable where you consider where this virus was to where it is now.
Absolutely. There's been tremendous progress in the field of HIV. And, we're so fortunate to live in Canada where just about everyone who's infected with HIV and positive for HIV has access to care. Is it perfect? Of course, it's not perfect. There's still room for improvement. But, in most instances in Canada, we have people on antiretroviral therapy or HIV therapy. And, decades ago, this sadly was a death sentence. And of course, in many other parts of the world, there's not the same access of care. But now we have most people in Canada, for example, on one pill once a day, and people can expect a normal life expectancy. And when their virus is suppressed, meaning when they take their one pill once a day, they're not, we don't detect the virus in their blood, they don't transmit HIV to other people. So, I think the biggest issue now is obviously ensuring everyone has access to care, access to therapeutics, and really reducing stigma and really informing people who are at risk for HIV to come out and get tested, reducing stigma in the general community, because this is really, for the vast majority of people, a one pill once a day infection, and people can live a long, healthy, happy, and completely normal life with this infection.
Yeah, it is pretty amazing to hear those sort of words. No doubt about that. Appreciate that, Dr. Bogoch. In the meantime, let's talk about West Nile virus. We've talked about it, closer to home here in Scarborough, in Brantford as well. So it's been detected now. We've seen it. Public health saying there's not necessarily any risk, but maybe it's a good time to sort of go through not only the symptoms of it, but also prevention.
Right. So, yeah, West Nile virus is a mosquito-transmitted infection. We certainly have it in Canada. It's in many other parts of the world. We usually see it presenting in people in the later summer, early fall. It's already been detected in mosquito populations in a few places in Canada, including around the Greater Toronto area. About 80% of people will have very mild symptoms. Some people will have no symptoms at all. Sometimes the symptoms is predominantly just a fever that self-resolves. In very, very rare cases, you can have severe neurologic manifestations, including paralysis. Again, that's severe. It's also extremely rare, but of course, it does sadly happen. Prevention's very straightforward. It's mosquito repellents. Just avoid getting bit by mosquitoes. We know we can get commercially available insect repellents. DEET or Icardin products are widely available, and those are really helpful, especially when mosquitoes are biting. But apart from that, we will see West Nile this year like we see in prior years, and it's just another thing to be mindful of. By no means does this mean don't go outside. Of course, go outside, enjoy the wonderful Canadian summers, but some bug spray is always a little bit helpful.
Yeah, an ounce of prevention worth a pound of cure, I think doctors have said in the past. In the meantime, last week, Dr. Bogoch, we were talking about the U.S. FDA approval of this RSV antibody for use. Now there's an infant vaccine approved for use as well here. This is just in time, of course, the CDC is issuing a warning about the return of the so-called triple-demic this fall. That, of course, flu, COVID, and RSV. So again, not trying to scare people, but just give the facts out here. So what do you make of this here, this idea about the RSV antibody?
Yeah, this is really interesting. So there's sort of two branches here. There's RSV vaccines that are in development, and we've seen some tremendous progress on that front. But this is something called an RSV monoclonal antibody. It's called nirsevimab. And what's really interesting about this is instead of giving someone a vaccine, the vaccine stimulates your body to produce antibodies that fight off infection. This is actually just producing the antibody, and the plan would be to give it to young children who are at risk for RSV infection and hospitalization. And this was approved in Canada in April of this year. We'll likely hear from the provincial governments in terms of how it might be rolled out. The clinical trials look very promising. It reduced RSV-related hospitalizations by about 76%. So certainly a very promising therapeutic. And hopefully we see this roll out soon in Ontario.
Yeah, let's hope so indeed. That's good to hear. Listen, Dr. Bogoch, we appreciate you taking a few minutes this morning out of your vacation to join us here, as you do on almost every Tuesday morning. So thanks for that. Enjoy your time, and we'll chat really soon.
Have a great day. Thank you.